Good morning, everyone, and welcome. We are going to give people just 1 minute to get onto the webinar, and then we'll start right at 10. All right. Welcome, everybody. Good morning. I hope you're all having a good day so far. Welcome to today's web seminar. This is Simone Turek-Lee with John Burton Advocates for Youth, and thanks for joining us. We are today going to be sharing with you a brand new publication that we've released called Key to Compliance: Reproductive and Sexual Health Policies and Practices for STRTPs. This publication equips short-term residential therapeutic programs, or STRTPs, with policies and practices really to ensure they're compliant with all of the mandates in the area of reproductive and sexual health, as well as provides best practices. So let's dive right in. If we can advance to the next slide, we'll just go over a few housekeeping details as we always do. So you'll see on the control panel on the right-hand side of the screen, there are handouts, and you'll also see that information in the chat box. If you uncollapse the handouts section of the control panel, you'll be able to access those documents. We'll also be holding a question and answer session at the end of the webinar, so please do not hesitate to send us your questions at any point starting now throughout the webinar, and we'll get into as many questions as possible during the Q&A. We always record the web seminars, so we'll be posting that recording along with these slides and any other information that we promise you throughout the webinar on our website at the link on the screen. And we'll also email out the materials to everyone who registered today. And I do just want to say we have a huge number of you joining us today. We're thrilled to have so many counties and STRTPs and advocates and tons of other folks on the webinar today. And we are looking forward to the next hour and a half with you. So the agenda for today, if we can move on to the next slide, we're going to start with welcoming our panelists. Then we'll provide some context and background on reproductive and sexual health and wellness. We'll share some information about a learning community that we're leading on this topic for STRTPs, and then we'll dive into the publication we've released, which really covers 5 focus areas with recommendations in each. And lastly, we'll end with our Q&A. So next slide, please. I'd like to first introduce Anna Johnson. She is the Senior Project Manager for Housing and Health here at John Burton Advocates for Youth, and Anna is the primary author of the publication we'll be sharing today. Again, I'm Simone Turek-Lee, Director of Housing and Health here at JBay, and we're also joined by Christina Torres, a youth advocate with JBay as well. Our next panelists all work for STRTPs and will be sharing some of their policies and practices with us today. We're joined by Dr. Clayton Johnson, the Director of Training and Development at Rancho San Antonio. We're also joined by Gina Peck, Vice President, and Julie Farino, Assistant Director at Hathaway Sycamores. And lastly, Alyssa Miller, Program Manager at Hillside. So now I'm going to turn it over to Anna, and she'll provide some background on reproductive and sexual health for youth in foster care.
Thank you, Simone, and good morning, everyone joining us today. My name is Anna Johnson. I'm a Senior Project Manager for Housing and Health here at JBay, and I'll be talking to you about reproductive and sexual health needs of youth in care. What the data does show us is that foster youth are at heightened risk to experience systemic barriers, frequent placement changes, and these barriers can lead to a heightened risk of intimate partner violence, sexual exploitation, unintended pregnancy, poor prenatal and birth outcomes, and sexually transmitted infections. It's critical that we work together toward healthy futures for foster youth. So first, I just want to share how important it is that all of us here today, caregivers, staff, case managers, attorneys, mentors, educators, and advocates, have open conversations about healthy sexual development with youth. Taking the time to promote positive, healthy development with children and youth is our responsibility, and it does work. So what I'll cover reveals some of the existing disparities in reproductive and sexual health outcomes between youth in care and their peers not in care across California. Before jumping into those statistics, I just want to go over that we live in a society where youth experiences with their bodies, their voice, and their safety can be very different. Emotional, verbal, physical, and sexual abuse are all too common, and too many children have had their voices and bodies ignored, neglected, or hurt by adults and do not have the power or control over the environments that they live in. So every youth in care has had their own experience, but as a group, foster youth are less likely to receive that sexual health education, information, and health care, which leads to those negative health outcomes.
Anna, I'm going to just interrupt you real quick. I think we might be having a sound issue unless it's just specific to a few people. If people can hear me, can you please just message us in the questions box? Okay, so it must just be a couple. There's a few people having audio issues. Let's continue and I'll help them independently in the questions box. Thanks, everybody. Please continue, Anna. Sorry about that.
Okay, and I'm sorry about the people who can't hear us. The purpose of our work today, and good to see everybody who is here. We have a lot of attendees, and we're here to help youth and to do this together, so that's really positive. And what we want to do is acknowledge the harms and as responsible caregivers create environments and relationships that are healthy for youth, that honor their minds, bodies, identities, and center their voice and their agency as they grow and develop. Equipping children and youth with age-appropriate, medically accurate information about bodies, minds, relationships, dating, intimacy, and families sets youth up for that healthy future that we want them to have. So that's why we're all here today, to talk about the tangible actions staff and caregivers can take that help youth grow and mature. So how do we as individuals and organizations serving foster youth do this? Well, first, we work with our strengths. I'm just going to move the slide here. So California does have a robust network of information and services that STRTP staff and counties can draw upon. State law makes comprehensive sexual health education in public middle and high schools mandatory. We have consent rights allowing adolescents to confidentially access care. California has a network of clinics specially trained to address adolescent needs. We have invested into public funding streams for sexual health services to ensure they have free access to care, and foster youth do have Medi-Cal coverage. So California has provided also trustworthy information for teens and adult caregivers on reproductive and sexual health. From our Department of Social Services and licensing divisions have vetted those materials, and we have a lot of strengths that will help us achieve our goals. But we're actually up against a lot. What's really going on right now and causing some of these barriers and issues that I'll talk about in a moment. Well, the same California that has these strengths is also, as you all know, dealing with COVID-19, the Me Too movement. We have extensive racism, homophobia, and transphobia in our society at large. And this can lead to we have the trafficking and exploitation of children and child abuse. So these are all the things I just named are public health crises. And there's so many ways through our larger society and our communities and even within family units that children can hear hurtful and harmful messages about their body, themselves, and their identities, and that impacts their reproductive health, their sexual health. So naming that we're in the midst of co-occurring health pandemics is unfortunately not enough. We have to take tangible steps towards health equity. So I know that's why we're here today, and somewhat we are in the choir. So as supporters of foster youth, what do we do? How and when do we start these conversations? And who is responsible for what part of this conversation about reproductive and sexual health? These are some of the questions we all ask. So we're going to clear that up today. Our publication talks through that, and that's a lot of what we'll talk about here. One of the reasons it's so important is that foster youth often hear they're too young for reproductive and sexual health information, or adults are unsure and they wait for youth to start the conversation. But the truth is there's no better time than the present. Our studies show that stress and abuse can impact children's growth and development and jumpstart adolescence. And some girls begin puberty a year earlier than their peers. So these conversations about body development, hygiene, menstruation, all of this really, the question isn't necessarily too soon. It's how and what's age and developmentally appropriate. We do know that research shows that teens in foster care have an earlier sexual debut and are less likely to use contraception compared to teens generally. So again, frequent and early conversations about emotions, relationships, consent, and sex are needed. One statewide goal that we have as a healthy sexual development work group is to reduce the number and frequency of contracted sexually transmitted infections of foster youth who are at least 3 times more likely to have certain sexually transmitted infections. And we cannot simply talk about the body, hygiene, menstruation. We have to include safe sex, contraceptive counseling access, and access to contraceptions, which are effective ways to reduce sexually transmitted infections. So we know what some of these solutions are, but we need to make sure those solutions are received by foster youth and accessible. Another important focus of the work is to have educational opportunities to learn about healthy relationships, consent, and negotiation. It can be very hard to understand dating and relationships when you're a young person who's grown up with abuse or neglect or have had unhealthy environments or treatments. And intimate partner violence increases the likelihood that teen mothers will become pregnant, have difficulty refusing sex and negotiating contraceptive use, and repeat a pregnancy. Intimate partner violence involves birth control sabotage and forced sex. And we want to be able to teach youth about consent, negotiating boundaries, safe sex, and knowing what red flags are in relationships before dating so they can receive help, assistance in those relationships and have healthy experiences. California as a whole has seen an 82% decrease in the teen birth rate from a peak year in 1991. California's birth rate in 2018 was 13 girls for every 1,000 girls. But the pregnancy rate of female foster youth is more than double that of the general population. So 26% at age 17 and nearly 50% at age 19 have been pregnant, with 1 in 5 being pregnant 2 or more times by age 19. Youth in care who carried a pregnancy, the California Youth Study did survey teens in California foster care. 70% of those experiencing pregnancy said the pregnancies were unintended, with only a quarter of the youth reporting that they used contraception at that last pregnancy. So I'll talk later about some of the barriers youth face in information about safe sex, contraception, and access, but a statewide goal is to increase sexual health education and contraceptive counseling and reduce unintended pregnancy among foster youth. So youth who did carry a pregnancy, unfortunately, are experiencing poorer birth outcomes than their peers. So at age 17, more foster youth who were pregnant experienced a stillbirth or a miscarriage than had a live birth. So 1 in 5 never received prenatal care. So continuing with the status quo of our current access and service delivery, that will leave foster youth with these painful and costly experiences. And again, the good news here is that we do know what works to prevent STIs and to reduce unintended pregnancies and to provide proper prenatal and postnatal care. So we do know what's needed. It's about getting that access and making those connective linkages. Before moving on from the data, I just want to talk a little bit more about some specific demographic populations of youth in care who are often overrepresented in STRTP placements. So foster youth do experience greater levels of sexual exploitation compared to their peers, particularly those who are placed in group homes and STRTPs. So many STRTPs are actually serving youth right now who have or are actively being exploited. And STRTP staff need to be able to use harm reduction and trauma-informed approaches and language in their conversations and assist youth in accessing services. We also see sexual health disparities among youth who have disabilities and intellectual disabilities. So they're often not able to access sexual health education content. While most young people with mild or moderate intellectual disabilities have had sex by age 19 or 20, they were more likely to have unprotected sex 50% or more of the time than their peers. So STRTPs are serving youth with intellectual disabilities and need to know how to share information in a developmentally appropriate manner. Everyone on this call most likely has heard a lot of the disparities about youth of color being overrepresented in foster care in general, but also in STRTP placement settings compared to the general population and their peers in foster care. So cultural competency training and considerations need to be applied when working with youth on their health, hygiene, and access to providers who will provide quality of care. There's also disparities in the public health field and health access about how youth of color experience treatment from their doctors. And so working with youth, allowing them the provider of their choice, helping them find a provider that gives them quality of care is part of the role as staff, as parent and caregiver. Additionally, youth who identify as LGBTQ are overrepresented in foster care and are 2 times more likely to be placed in an STRTP setting. So we need STRTP staff who are trained and welcoming to LGBTQ youth and their reproductive and sexual health needs. So zooming back out from these demographic populations, we know California has many resources. We are all here today. We've got a lot of people power as well. So how do we overcome what are the common barriers and how do we overcome them? So some of the most common barriers around reproductive and sexual health are logistical barriers. So not having transportation available in a timely manner or refusal by caregivers to bring youth to a service. Youth rights have been infringed upon through things like contraception being confiscated or taken away, and through many violations of those rights, not allowing youth to see the provider of their choice or things like that. There's also been so many placement changes for many youth that lead them to miss sexual health education in their school. And then if there's no follow-up to provide that, they never get it. And then finally, when we don't have policies and training in place, we have this inconsistent communication from adults to foster youth about growth and development and reproductive and sexual health. With all of that concern for foster youth health and that information about the barriers in mind, the California legislature passed Senate Bill 89 in 2017, requiring 3 key mandates. So this is the current law that we're working on implementing now and improving these health outcomes for youth in foster care. So the law requires case managers to confirm with the youth's middle and high school that they received comprehensive sexual health education at least once in middle and once in high school. And if the youth missed it in school, the case manager then has to arrange for the youth to receive that in another manner. So the law, secondly, requires that the case manager inform the youth of their reproductive and sexual health rights and document that in the case plan. And third, it requires sexual health training for caregivers, case managers, and judges. So there are a number of resources that are available and free to use to help implement these policies. And JBay has a publication on Senate Bill 89 implementation at the county level available on our website if you'd like to learn more. And we are a few years into implementation now. This passed in 2017. And so we'd like to be able to see more recent reproductive and sexual health data to see if the law and implementation are having the intended impact from the times we've seen these other kind of data pieces. So thank you for reviewing the data with me, and that sets us up on our path of action. So next, I'd like to introduce to you all Christina Torres. And Christina is a student at Bakersfield College. Her goal is to become a social worker or an advocate for foster youth. And after graduation, she'll be pursuing a career in child welfare. Christina has experienced foster care and homelessness and has a passion to work for youth on behalf of youth who have experienced the same. And she's going to share with you today how she received support from a group home when she was younger. So Christina, can you hear us? Can you introduce yourself and take it away?
Hello. Good morning, everyone. My name is Christina Torres. I'm 24 and I'm from Bakersfield, California. I have 3 kids. I'm currently a student at Bakersfield College working towards a degree in business, and I will graduate in 2024. I am here to talk to you about the importance of caregivers in supporting foster youth with reproductive and sexual health. I want youth to be educated. Many youth are not receiving the sexual health education they need to be healthy. This is such an important topic and issue with child sex trafficking, sexually transmitted infections, and pregnancy. I know that this can be hard as a caregiver. I'm a parent myself. I'm trying to be different now as a parent. I haven't told my daughter the whole birds and the bees yet, but I am talking to her about her period and hygiene and puberty because she is 8. I was 15 when I had her. I was just a kid and I had a kid. No one was talking to me about this, and we need to change that. I'm going to change that as a parent. So I thank you all for being on this call, and I thank J-Bay for talking about this issue. There are some things I'd like you to know to better understand the context of what's going on with the system and what was happening when I was in middle school and high school. In middle school, I did not receive sexual health education. My high school at Bakersfield High had regular health, but you only get that your freshman or your senior year in high school. In order to receive the parenting classes at the school, you had already had to be a parent. I got pregnant the summer before my sophomore year in high school, and I had my daughter when I was 15. I entered into a group home 9 months after I had Angelina. Her birth was different than my other 2 kids because it was before I ever. Sorry. No, you need to get inside now. Her birth was different than my other 2 kids because it was before I ever received sexual health orientation and education and parenting classes. I received these after I had Angelina. I had my other 2 children when I was 19 and 21 in extended foster care in a SILP. One thing my group home did well was to provide me with sexual health education and parenting classes when I was 16. I lived in a group home when I was 16, and they provided me with sexual health education, parenting classes, and sexual health services. Girls who didn't have kids were in one class, and the girls who had kids were in another. The staff provided parenting classes with initiatives and gift cards, and we received certificates for completing the class. In the classes, I learned a lot that I didn't know. It helped me with Angelina. She was 3 months old at the time, and I learned how to wash the baby's clothes and things before using them, how to comfort her when she cries, how to check her stomach and take care of her. It was really helpful. In the sexual health classes, I learned about doing sexual health checkups, when you have a new partner, birth control choices, and how to use them, like how to use a condom, check the expiration date, and wrapper. We learned how to take care of yourself and our hygiene. They taught the girls how to use tampons and showed us how to use the pads and take care of menstruation and hygiene. I had clearly already had a period before the age of 16, so it would have been nice to have this information sooner, but it was helpful that we got that information at all. After the classes, or when I was in the group home, the staff helped me with health appointments. I was able to get birth control with their help. The group home staff helped me take care of Angelina when I was sick. They helped me with the rides to appointments and services I needed. And they also helped me get into my first apartment when I was 19. They did a lot for me. I was able to access prenatal care for all 3 of my children with the help from my social worker when I was in AB 12. Some things that my group home could have done better was at the time when I was in the group home, I didn't have a choice of provider. I was told to use the group home providers. The OBGYN was across town and the physicals were all the way in Wasco. I had my own doctor where I was going to and I liked seeing them, and I also had my own OBGYN. But this all changed when I entered the group home. At the time, I didn't know, but now I know that it is my right to choose my provider. So I would recommend to STRTPs to make sure they know the rights of the youth and have the rights of the youth listed and shared with them. One recommendation I have is that the home has classes 2 times a year instead of once a year. This would have helped me retain the information throughout the year. And in closing, I'd like to say is I believe that youth in care need to retain this information based on everything that is happening in California with teen pregnancy, about sexually transmitted infections, how to deal with their partners if they are dating or having sex. Caseworkers and STRTP staff should start talking to youth early. I started my period when I was 9 and a half. I just like the youth to understand what is going on, how to keep themselves safe, and have people there to support them during those changes. I'm glad you're all speaking about this. It is important that you are all talking to youth and teenagers about sex and safe sex. They do not get a lot of information like this. I feel like they need these conversations more often and started around early middle school. I'd love to hear the audience and participants on today's call about how you plan to take this information back to the youth you are working with and to implement this law. So please ask questions, leave comments, reach out with your ideas, resources, and plans for helping youth with their reproductive and sexual health. Go ahead and put in your questions and comments now in the control panel, and I'll answer them at the end of the presentation. Now, I would like to hand it off to Simone.
Thank you, Christina, just for sharing your life with us and being so candid about your feelings and your experiences. We really appreciate it, and I think also just sharing your thoughts and recommendations for how organizations can improve and continue to improve is really valuable. So thank you. And, just someone shared this in the chat, but they said, we're all in the same boat with our kids. Christina, we heard your kid in the background. A lot of us are in that scenario where we're working from home and we don't necessarily have childcare. And so people were just kind of saying to you that they get it. But thanks for joining us today. So you heard from Anna kind of why the focus on foster youth as far as wanting to improve outcomes related to reproductive and sexual health. You also heard from Christina in that area. And you also heard from both of them kind of why we're focusing some of this work specifically on STRTPs. Let's talk a little bit more about that. So when we step back and kind of as of April 1st, 2020, look at how many youth were placed in STRTPs, kind of all of foster care, so all the children and youth in foster care, total 62,013. So that's how many youth in our state are in the foster care system. Then 3,421 of them are specifically placed in STRTPs. That's just under 6%, which is it's a small number of youth relative to the larger foster care population in our state. But the needs of this population are significant. Kind of as you heard from Anna, this is the placement that provides the highest level of treatment and supervision for youth in foster care, and it's our congregate care placement now that we've transitioned away from we are transitioning away from group homes under continuum of care reform. There are a number of mandates in place in terms of reproductive and sexual health that county agencies and placement providers have to abide by. Mainly those that were set forth in SB 89. And as people who are providing care to foster youth, whether as foster parents or in a facility like an STRTP, these people are uniquely positioned to impact a youth's experience during a really critical time in their lives, those adolescent years, and in some cases into early adulthood. So it's so important that these individuals are really equipped with the tools to do so. So That's really why we're here today, and it's why we launched a learning community. Anna, if you can advance to the next slide. So back in March, as part of our work under the LA Reproductive Health Equity Project for Foster Youth, also known as LA REP, and that's a collective impact campaign led by National Center for Youth Law and funded by Hilton Foundation, that where we work with a number of other organizations on this issue. So kind of under our work, with our work under that project, we launched a learning community in March for STRTPs. The learning community is a little over a year long, and it focuses on all the things you see there on the screen. So promoting positive, healthy, and comprehensive sexual health education, equipping staff members with tools and training, ensuring policies and procedures are compliant with state law, reducing the risks foster youth experience related to unintended pregnancy, prenatal and birth outcomes, and STIs. So that's really kind of, those are our goals, and it's the focus of the learning community. Really, we're providing technical assistance and training, and then tools like the guide we're releasing today in order to assist the participating STRTPs with all of these goals on the slide. So the guide we're sharing today, it's really the foundation of the learning community. It's what the training and TA is really centered around. So you'll hear from learning community participants today about how they've either have existing policies and practices in place that they're sharing with their peers in the learning community in one of the 5 issue areas we'll cover, or that they're working on implementing as part of the learning community. So the kind of the beauty of the learning community model is that the participating STRTPs are all in different places with their strengths and their areas of desired change. And so there's great peer sharing and peer learning, across organizations and across the state. So if the next slide shares with you who these great people are, there are currently 11 organizations participating that have STRTPs across 6 counties that you can see on the screen there. And together, these STRTPs serve about 480 youth on any given day. I really want to take a second to applaud all 11 of these organizations. They're not only, stepping up and saying, this is important, we want to prioritize this, we care about the reproductive and sexual health of our young people, but they're also doing it during the pandemic. We launched on March 2nd, I think it was. Our in-person kickoff very quickly turned into a Zoom kickoff, but we've stuck with it. People are learning, we're learning, and we're going to keep meeting monthly on Zoom and working together to achieve the goals. So I'm going to pause for a second. One of our panelists, Dr. Clayton Johnson, was joining us a little bit late. He'll be speaking in a few minutes, but I'm seeing, Clayton, that you have joined by video, and I just want to let you know that no one else is on video. So if you want to get rid of your video, that's fine. If you'd like to keep your video, that's fine too, but I wanted to let you know.
Oh.
So Anna, if you can advance to the next slide. So the reason for today's webinar, we released a publication. It's available now on our website. It provides policy and practice recommendations that, if adopted, will ensure an STRTP is in compliance with state laws and regulations and is utilizing best practice in reproductive and sexual health. It's also, chock full of links to resources you can use to actually implement the recommendations. And I just pasted the link that's on the screen there into the chat box so that if folks want to look at it now and they haven't already done so from the earlier link, they can do that. Anna, if you can advance to the next slide. So the guide's broken up, and Clayton, Dr. Johnson, just so you know, we can still see your video. So if you do want to exit out of your video, feel free. So the guide's broken up into 5 focus areas. The first one is training staff. The second one is maintaining confidentiality. The third is access to care and barrier removal. The fourth is sexual health education for youth. And then the fifth is protecting youth from bias and discrimination. So this is kind of how we've broken up our focus areas for the learning community and for this guide. So first, if we advance to the next slide, we're going to cover our first focus area, And Dr. Johnson, we can still see your video, just so you know. The first recommendation is to train staff upon hire and at regular intervals to ensure they're well-versed on youth reproductive and sexual health topics. So that's in our focus area of training. And this is kind of where we started with the learning community. Now, under SB 89, reproductive and sexual health is a required topic in the administrator training for STRTPs, but it's not actually required of staff, the training is not. However, as I mentioned previously, there's no shortage of state mandates related to reproductive and sexual health. So you almost kind of, as an STRTP, can't get away with not training your staff on these topics if you want to be in compliance with the law, and of course, if you want to provide the best quality of care, to young people in your program, you want to make sure your staff are equipped to talk to youth about these topics if asked and to provide the appropriate resources. So that really means onboarding training, and it means regular training, perhaps annually. And it means addressing these topics during staff meetings, during supervision, and really during the hiring process as well. So in the guide and the appendix we have provides, there's a resource index. It provides a ton of different resources, like we said, for implementing these recommendations. And so you'll see on each of our slides that have these recommendations, there's a little purple box or table that lists the kind of corresponding resources. We won't go into detail on these during the presentation, but you'll have them later to refer back to. Next slide, please. And I should have probably mentioned what is in that table are the different trainings that are available. And so there are some generalized trainings that are available for multiple audiences that the state has provided. But what we really want to draw your attention to today are some brand new training tools that LA Rep has developed that literally just came online. So you can see there are two versions of this new training available specifically. These are specifically for STRTPs. You can see on the left side what the training curriculum covers, all of the necessary topics. It's SB 89 compliant. And then on the right, you see there's an online version of this, basically a course you can take on udemy.com where staff can self-administer. And then there's a live in-person option, which is basically a training guide that STRTPs can download with a bunch of corresponding materials and kind of, just offer it in-house in person if they'd like. We are hosting a webinar with LA Rep on the 30th of this month to go over these training tools and to share more information and answer questions. The link for registration, I'm going to paste into the chat box so that if you want to go ahead and register right now, you can. So we hope that you join us for that. If we can go to the next slide now. As I mentioned, training is really the first area we covered during the learning community. So we have a couple panelists here to talk about either their existing practices in this area or in what they're implementing as part of the learning community. So first, we're joined by Gina Peck, Vice President, and Julie Farino, Assistant Director at Hathaway Sycamore's Child and Family Services, that's in LA County, to talk about their best practices that they utilize with training, hiring, and ongoing supervision.
Thank you, Simone. Like she said, can we have the next slide? Like Simone mentioned, we are from Hathaway Sycamores, and the World Health Organization describes sexual health as encompassing not only physical health, but also mental and emotional health. And it also contributes to our sense of social well-being. The WHO then goes on to say that in order to attain sexual health, every person's sexual rights must be respected, protected, and fulfilled. So we all must learn how to do this. And then in turn, we need to teach others how to do this. And in saying that, like Anna said, we need people who are welcoming and open to any sort of youth that we interact with. Next slide.
Hi, this is Gina Pexobolitsky, and I'm the Vice President of Residential at Hathaway Sycamores. And I'm going to just talk a little bit about how we conduct the interview process. We have sort of a unique approach to how we conduct interviews. We utilize structured interview questions that give potential staff an idea of what we expect in terms of transparency, and it also gives us an idea of the propensity of the potential staff to do this work in a supportive way for our youth. We also run panel interviews, so we may have several different folks, members of leadership, asking specific questions. A couple different questions we may ask is, do you believe that young people can make good decisions about their sexual and reproductive health? And are you really able to support these youth unconditionally, even if your personal values differ? We do expect personal values to differ, and we're not challenging personal views. We are just wanting to support an unconditional environment for our youth. We also run vignettes and scenarios, and those can be along the lines of trauma-informed care. What might someone do in terms of restorative justice? Referencing SOGI and sexual health rights. We also incorporate youth and peer advocate participation in our interviews. We have had our STRTP youth directly participate in the interviews. They take it very seriously. They ask specific questions. They plan, they prepare. We also have a former foster youth who is employed with us as a peer advocate. He works part-time. He's an adult. He's a college student. And he also participates in those interviews. So I think that gives us a really good handle on being able to get a youth perspective also on some of the content that we elicit. We can move to the next slide.
So in order to provide those trainings for our staff, we work very closely with our awesome Planned Parenthood department. They've been helpful in teaching not only our staff in giving that kind of information, but also provide education to youth. I know that when we've done this, I hear from the providers that the youth are really interested in the physiology or the anatomy. They're not really sure how things really work, especially regarding the opposite sex. So we provide a lot of training to the kids, but also for our staff, we provide a minimum of 6 hours or 6 trainings a year. And topics include SOGI, implicit bias, and we try to give a lot of information on rights, the rights of the youth and the law.
And those 6 trainings equal a minimum of about 8 hours. And we've worked on developing a unique list of topics with Planned Parenthood, and they've been gracious in being able to provide those to us really on demand. Some of the other things that we're doing in terms of training and supervision is in our individual supervision, coaching and accountability plans with our staff. So we stay on top of this at various touch points. We practice transparent communication. We confront resistance in a sensitive way. We all have different views, which is wonderful. And I think that's what makes it such a flavorful environment. We support from the top down so that anyone can approach leadership at any level to get questions answered or to give feedback. And we do believe in that 360 feedback. Also, in terms of our unit and our team meetings, we don't avoid the real issues. And I put that in quote because that's just something that's a mantra that we have, so to speak. We confront sensitively. We have had staff that have asked a lot of questions, especially there's one situation that comes to mind where staff had an issue with the age of consent laws in terms of age of consent for reproductive counsel and contraception. And there were some differing views, and we were able to work through that in a way that I think ended on a very positive note. And I think that's the issue. It's like those conversations need to happen, and leadership really needs to be supportive of those. And I think that's all we have. So we'll turn it over to Simone. Thank you.
Thank you, Gina and Julie. We appreciate you joining us today. Now I'd like to introduce Dr. Clayton Johnson, who is the Director of Training and Development at Rancho San Antonio, also in LA County. Dr. Johnson began the learning community hoping to implement new training on reproductive and sexual health, and he's going to briefly share kind of what they're rolling out at Rancho San Antonio.
Perfect. Thank you very much, Simone. Can everyone hear me?
Yes, we can hear you.
Perfect. Thank you. I definitely agree with so many of the comments made by the staff from Hathaway Sycamore. Very, very important that the training supports the framework of the program that is essential to the actual education of this topic. And that's why I would definitely encourage participating in the learning community. It has been very, very important and essential for all of us to share ideas, support each other, share resources as to how we can learn and grow throughout this process. So that's the first point. Second, when it comes to the requirements, the speaker prior to me kind of mentioned it as far as 6 specific trainings totaling about 8 hours. One of the things that I have found very, very helpful if going to the John Burton website and utilizing the resources that they have. They are free of charge. It's a combination of videos, but also I would say like pamphlets / worksheets. It's been very, very helpful in the education and the rolling out of this program from the point of where we're not just handing out paperwork for people to read. We're actually engaging people in conversation through videos, receiving feedback, and that has been very, very helpful in the education of our staff. I would transition to that into saying that the employee investment is essential to the rollout of this training. And what that means is to ensure that you have complete investment in the topics, in the beliefs, and the freedom of choice when it comes to all of the information that the staff are going to be receiving. One of the things that we're doing at my agency is we are taking this program and we're incorporating it into our Cultural Awareness Committee. And our Cultural Awareness Committee, we throughout the entire year, we celebrate different cultures. For example, Black History Month. September is Hispanic Heritage Month, and many different things. But we're going to incorporate this curriculum, and we're going to infuse this curriculum into that program so that we can roll it out into our group therapy sessions and just capitalize on as many people as possible to be present. So let's separate the two. One, the staff are going to be educated by their supervisors. And like I said, if you go to the John Burton website, there are so many different resources that you can utilize, not just videos, but also worksheets that will be very, very helpful. And with that, educating them, there are also resources and videos for the youth to utilize those videos and resources so that you can educate the youth. And the main reason why it's so important that you educate the staff first, in my opinion, is because the youth, a lot of the times when they watch something or they take in any kind of information, they're looking to ask questions afterwards. and you want to ensure that your staff have the information to answer those questions appropriately. I definitely agree and support the hiring process and asking specific questions as far as the freedom of choice, or what are your views on this. And it's not to single out anyone, but it's more so to see that, to ensure that you have individuals that are open to different ways of thought opposed to their own. So I think that would be very, very helpful. And when it comes to the overall training of the agency, whomever is in charge of that, like for example, in my agency, we have what's called an annual training calendar, right? And I would recommend something that we're doing is we have a monthly review, right? And in that monthly review, we discuss the month. So September, we're going to meet. We're going to discuss October. What does October look like? What trainings do we have? Who has to attend? And in that, that's going to be very, very helpful to know in advance. Okay, clear your schedules. You need to come to this training. This is mandatory. We need these hours, X, Y, and Z. But we also have what's called an annual training calendar, where we have, well, I'm the person who would write out the calendar for the entire year. And when that calendar is written out for the entire year, I try to put in all of the mandatory trainings into the calendar. Wednesday is a big day for us, and month to month, if something else comes up, we can revise accordingly. But to infuse this curriculum into your teaching foundation and to your onboarding foundation is definitely recommended and encouraged, because working with an STRTP, it is very important that a platform is created, or a space is created where people feel free to be who they are. And for anyone who does not understand that, a space is created for them to be educated as to why that's important. So I think pretty much that is all I have as to regards of the training and rolling out the training. Are there any questions, or do we just move on to the next?
Thank you, Dr. Johnson. We do have a questions box where people can enter questions, and then at the very end of the webinar, we'll do a Q&A. So if people have questions,
Gotcha.
they can enter them into the questions box.
Perfect.
But thank you so much for joining us today, and we're going to now move on to focus area 2, maintaining confidentiality. This is an area where STRTPs actually have a lot of expertise. The recommendation here is to ensure staff are well informed about the privacy rights of youth, and that they're aware of procedures and protocols for upholding these legal rights. So, of course, STRTPs are held to standards created by HIPAA, the Health Insurance Portability and Accountability Act. And HIPAA requires confidential handling of protected health information. And that information also includes reproductive and sexual health care information. So this is something that's where that comes into play. But this is something that spans much broader than reproductive and sexual health. So, STRTPs are very familiar with HIPAA, and it's actually an area where we do see a lot of organizations have all the right policies in place. But where it really comes into play for reproductive and sexual health, I'll give a couple examples. Staff need to know, what's considered confidential information and who's allowed to access it. They need to know they can't, just enter a health appointment where a youth has seen a health provider, or join a telehealth appointment, without the youth's permission. They can't kind of just walk into the office with the young person and be part of that appointment unless they're invited. Organizations need to have protocols for how to securely share confidential information, which includes, not being able to speak about certain things in front of other staff or other youth. This is one that comes up a lot. Youth have the right to make, send, and receive confidential phone calls, and to send and receive unopened mail unless prohibited by court order. So that's something that often I think is not always, intuitive. And so these are just important things to be aware of. And I mentioned in the appendix, there's a resource index, and so there are some resources there for explaining confidentiality and minor consent. Next slide. So there's just 2 recommendations in this section. So this is the last recommendation in the confidentiality focus area. And it's to assist youth in accessing copies of their personal health records and information from their health providers in compliance with state law. So current and former foster youth have the right to view and receive a copy of their child welfare records, juvenile court records, and educational records at no cost until age 26. And so subject to existing federal and state confidentiality laws, that's really, that's what the law says. So staff should assist youth in obtaining any of these records from the necessary party. And I just want to, say, I know we're going to Q&A at the end, but someone messaged, there are some safety issues with phones. Absolutely. And that is why, we're doing this learning community. We know that this is not easy. And especially for an STRTP there are a lot of supervision and restriction, policies that are in place for reasons of safety. And sometimes it's not always totally obvious how to work within those guidelines and also meet these mandates. And so that's kind of what the learning community, that's what it really, the essence of it is, figuring all of that out. How do you do both? So I just want to thank you for typing that in. So now we're going to move into the 3rd section. And this is by far the most robust section, and it's providing access to care and removing barriers. So recommendation 4 is provide timely transportation to health-related services. We get a lot of questions about this. It comes up a lot. Caregivers and foster care providers are required by state law to provide timely transportation to health-related services. So, many reproductive health services are time sensitive, for example, emergency contraception. So transportation really has to be provided in a timely manner in order to meet that requirement. And here's where the questions come in. And transportation does need to be provided regardless of the organizational or the staff's personal religious beliefs or preferences. And so that's, again, where these questions come into play. How do you negotiate or manage that, especially maybe as an organization that has that is maybe faith-based? And so those are a lot of the things that we talk about in the learning community. And again, in the appendix, there's clinic finder websites and then resources where these various requirements are described. So the recommendation number 5 is permit youth, if you can go to the next slide. Thanks, Anna. Permit youth to obtain sexual and reproductive health care services from the provider of their choice. So this has already come up. Christina talked about this. This is one of those challenges where, it may mean transporting youth somewhere that's not super close to your organization, but it is really important to maintain those relationships and that comfort. And so just a little bit of background here, youth don't need permission from anyone, and that includes parents, caregivers, staff, or the court to obtain sexual and reproductive healthcare services. So, it's really important. Why, like I said, while an STRTP might have, they might have contracted or preferred health providers that are close by, youth really have the right to continue to receive services from their previous provider, like Christina mentioned, or a new provider of their choice that maybe suits them best. So it's really important that an organization's policies are clear on this. And the resource index, again, includes, we have the clinic finders there, and those are great in identifying reputable providers. Recommendation number 6. So provide sufficient storage space for each youth's personal belongings, including reproductive and sexual health care items. So interim licensing standards require that youth are provided with closet space, drawer space, personal storage space, furniture, equipment, products, all of this stuff necessary for care and maintenance of personal hygiene, clothing, personal belongings, and reproductive and sexual health care products. So that's kind of included in that collection of items. And that includes contraception and the morning after pill. Again, something that comes up a lot. Organizations are sometimes surprised. I'm supposed to let youth keep that in their room? The answer is yes. So, we have to figure out some best practices and some ways of working within our organizations where that is possible and also safe. So youth have the right to store their personal belongings and to keep their contraception. And it's really important that organizations ensure staff are familiar with the various types of contraception, and that it's not mistakenly confiscated. Staff also should allow youth to express their gender identity with their appearance, their dress, their clothing, products, personal belongings, and behavior. So these are all kind of very related to this storage space. Seems like a simple policy, but it really encompasses a lot. Next slide, Anna. So here's another one that may not be obvious at first, where reproductive and sexual health comes into play. Facilitate access to extracurricular, cultural, racial, ethnic, personal enrichment, and social activities supportive of youth's identities in compliance with state law. So extracurricular activities are important for adolescents, obviously, and access is required by law for foster youth. This includes, computer technology and the internet, consistent with the youth's age, maturity, developmental level, sexual orientation, and gender identity and expression. So that's really where the reproductive and sexual health component of this comes in. The resource index, kind of in addition to sharing youth rights, also has resources about social activities that are specific to the LGBT community. Next slide, Anna. So this recommendation is assist youth in accessing age-appropriate, medically accurate information about reproductive health care, the prevention of unplanned pregnancy, and the prevention and treatment of STIs. So STRTPs have a really important opportunity here to play an important role in preventing unintended pregnancy and STIs and improving healthy birth outcomes. Staff really, can ensure access to contraceptive counseling that reduces unintended pregnancies and STI contraction. Staff, can assist pregnant and parenting youth in accessing care, which can lead to improved healthy birth outcomes. And staff really should be informed and capable of directing youth to reliable sources of information and then helping youth obtain care as needed. And again, some resources in the purple box there that are vetted by the state and by legal and medical professionals to help you do that. Next slide. So provide access to medications used for self-administration, including birth control and hormones, in accordance with the rights of youth. So, policies need to note the difference in storage requirements for various types of medication. So there, requirements pertaining to medication storage, they take into consideration, the youth's ability to self-administer, weighed against potential adverse effects if a dose is missed or too much medication is taken. So, some medications are required to be securely stored, and then some actually are permitted to be self-administered. And so it's important to know that reproductive and sexual health medications, as well as condoms and other birth control methods, are permitted to be self-administered and kept in the youth's possession and personal storage. So again, that's a question that we get a lot. And the resource index includes vetted trainings and guides that cover up-to-date medically accurate information. Next slide, Anna. Thank you. So these last two recommendations in this section, like I said, this is the most robust section, really pertain to pregnancy or expectant youth. So this one is respond to a youth's disclosure of pregnancy in compliance with confidentiality laws and promote early and easy access to pregnancy testing services and unbiased counseling. So first, if a youth discloses they're pregnant, staff should be clear on the appropriate next steps. We don't want staff feeling like, what do I do now? This is a lot. There should be some clear protocols there. So youth should be provided access to testing and information about options by a reputable provider and be provided timely transportation to seek services, care, or counseling from a reputable provider. The resource index has Planned Parenthood provider rosters in it and also clinic finders to help people do that. And then really the youth, if the youth intends to carry the pregnancy to term, the staff should encourage them to disclose that pregnancy to their county case manager or attorney. However, staff should assure youth that it's their decision when and whom they disclose to. And staff cannot disclose without the youth's permission unless the pregnancy is the result of an incident that's required to be reported in compliance with mandated reporting law. So that's really important to know. And what would be required under mandated reporting would be sexual assault or non-consensual sex or sex between individuals that have certain age differences. So next recommendation, or next slide, and this is the last one, provide timely, for this section, timely supportive services for expectant and parenting youth. So to be really clear, STRTPs do not and should not need to and should not wait for a youth to disclose their pregnancy to their county case manager in order to begin providing youth access to transportation, to prenatal care and services. So these are simultaneous things that should be happening, right? We don't want to delay prenatal care potentially because the youth is not ready to share with other folks. We want to, as soon as we know what's happening, get them access to what they need, and then work with them also to inform the necessary people at their, comfortable pace. STRTPs should be aware of their county's protocol for assisting expectant youth and of the local resources available. Some counties like LA, for example, have a very robust policy for assisting expectant youth. For the sake of time, I'm not going to review it. I really want to, but I don't want to. I think we're a little over. But check out the publication and you can learn more. And, in the very least, an STRTP can refer to a home visitation program like Nurse Family Partnership if there's one in the area. And also can, as requested by youth, staff can attend the child and family team meeting if one is called to discuss the plan, and can also, if the STRTP does not serve parenting youth specifically, really make sure that very good transition planning is happening if they are going to be relocating the youth in advance of their delivery date. So I'm going to pass it off to Anna to round us out with our last two sections here, and then we'll dive into, and we'll have one more presenter, and then we'll dive into Q&A.
Great, thank you, Simone, and thanks everyone. So focus area 4, I wanted to present this one because I'm a former teacher, used to teach middle school, and this area of focus describes California's legal mandates from the California Healthy Youth Act, which requires public schools to provide that comprehensive sexual health education once in middle and once in high school, and the California Foster Youth Sexual Health Education Act, SB 89, which requires the Child Welfare Probation Agency to ensure foster youth receive that education. And, the case manager has to contact the school, confirm they received CSE, and document it in the case plan. If the youth missed that CSE, they have to arrange for that to be provided in another manner, and must document that in the case plan, however that's going to be received. So STRTP staff should familiarize themselves with that law as part of child and family team meetings and their role as caregivers. It's really important for staff to know the role of the school and case manager and assist the county in ensuring this mandate is fulfilled. The law does define what comprehensive sexual health education must include, and the ACLU of California has a curriculum checklist to ensure that schools are providing it. The law requires that all instruction be age and developmentally appropriate, and it specifies that youth must be taught about abstinence, but as a part of all potential kind of safe sex options, including contraceptive options that prevent and reduce the spread of STIs and unintended pregnancy. And the law actually prohibits abstinence-only education as a part of public instruction. So while STRTPs are not mandated to provide the comprehensive sexual health education themselves, they do play a role in helping the county fulfill that requirement, which may mean referring the youth to a local sex education provider, providing transportation to those classes, or providing internet access if the class is offered online, especially now during COVID-19. So STRTPs also as caregivers should provide additional opportunities for youth to receive sexual health education, and receiving that once in middle and once in high school really results in youth only getting this twice over the course of 7 critical years of their development. And as Christina mentioned earlier, needing that retention of information and having these conversations more often really would have helped. So as a best practice, you should be provided this frequent kind of exposure to this information. And STRTPs can and should establish an ongoing practice of scheduling regular visits by local sexual health education providers, as Hathaway Sycamores discussed, and who you can contact is right here. These rosters provide a list of local Planned Parenthood affiliates, personal responsibility education program, or the information and education program providers who know what the comprehensive sexual health curriculum is and how to deliver it to adolescents. So now I'd like to introduce you to Alyssa Miller, who is a program manager at Hillsides and STRTP. And Alyssa is part of our learning community and will tell you a bit about her work.
Hi, everyone. Thanks so much, Anna. Yes, my name is Alyssa Miller. I'm a program manager at Hillsides STRTP located in Pasadena. So as discussed, I am a participant in the monthly learning community, and I just want to reiterate, this is a really great opportunity to connect with others, share ideas, brainstorm ways to begin incorporating SB 89 into our STRTP. As you can see on the slide, back in February, actually, our STRTP leadership group piloted a 4-hour staff training with LA Rep. And it was important for our identified trainers to attend this as well, since we'll be using a lot of that material when we begin to roll out our SB 89 staff training. This piloted training addressed the information required by SB 89 and used a mix of presentation, small and large group discussions, and activities, as well as practical strategies to support the implementation of these practices into our daily work. You can click on the next slide. So similar to what Hathaway Sycamores mentioned, Hillsides has been connected to our local Planned Parenthood of Pasadena, San Gabriel Valley for about 8 to 10 years now. And about 8 to 10 years ago, we recognized the need to implement educational programming for our clients around these topics of sexual health and reproduction. We noticed that actually a lot of the conversations about reproductive health and consent were occurring in therapy sessions, and many of our clients had not been taught proper hygiene. Our female clients were ill prepared when they started their menstrual cycle. And at the time, our staff really didn't have the right vocabulary and education and confidence on how to communicate and speak with our clients about this information. And so we really recognize the need of us connecting to Planned Parenthood and providing them the appropriate education on these topics. We also noticed that many of our youth had not received this information at school, maybe due to multiple placement changes. They just missed that year in school, or from previous foster homes, they had missed the information. So we definitely noticed a big need for it. And what we did was we connected with our local Planned Parenthood in hopes of bringing the Planned Parenthood educators to our campus. So for many years now, they've been actually holding groups with our clients of different age ranges. Hillsides actually takes clients 5 to 18. And so for our clients under 12, we focused on topics like basic hygiene, anatomy, puberty, and clients 12 to 18, it was evident they needed education around birth control, STIs, relationships, and consent. Next slide. And so what we do is we have Planned Parenthood actually come to our campus to hold these 5 consecutive groups in person. However, of course, right now they are over Zoom, and we've actually been able to make it work. And so we do hold these 5 consecutive groups for each age range on these topics. We actually have staff attend the groups, which is really helpful to provide the clients breaks, any prompts or redirections if needed. As you can imagine, a lot of these topics might be very challenging and even triggering for some of our clients and bring up some of their trauma. And so if clients need a break, that's what our staff is there for. But overall, our clients are actually very engaged. I think the small group setting where it's just like their cottage with their 8 to 10 clients of their age really provides a safe place for the clients. They ask a lot of questions. Some even share some personal stories if they feel comfortable. And at the end, as you can see on the slide, we provide a certificate of completion that I created. We have like a big pizza party, and when we give the certificate, we ask each client to share some things they learned from the 5 groups. So it's really a great opportunity for our clients. We try to hold these every 6 to 12 months. It definitely happens every 12 months, but I would like to start making sure we can do it every 6 months, especially now in STRTP clients are leaving or only staying for 6 to 12 months. Next slide, please. And lastly, what I'm working on right now is updating our youth rights protocol. So this is another major focus area for me to start. I've been able to post the youth rights brochure in our nursing department. I want to add it to our treatment hallways as well. And I really want our youth to know their rights right from intake. So I'm working with our directors on having our intake therapist or intake coordinator provide the brochure to our clients at intake and start to have some of these conversations with them right from intake. And then the attending therapist on the case will follow up with the client throughout treatment as needed. As we roll out the SB 89 training, staff will start to become more familiar with the youth rights and how to communicate these rights to our clients. The policy I'm working on will also include how youth can fill out a complaint or a grievance, and we'll have references to confidentiality and, of course, mandated reporting protocols. So this is what I'm working on right now, and actually the learning community provides a really great opportunity for me to share with others this policy, to receive feedback on the created policy, and to work together with all the STRTPs. So I hope this gives you all a good idea of what I've been working on for the past 6 months or so and how we're starting to implement SB 89 into our STRTP. And I will hand it back off to Anna. Thank you so much.
Thank you so much, Alyssa. It's really nice to hear all the progress that you've made so far, and just really strong practice. So the last focus area of the guide, Key to Compliance, is it focuses on upholding the rights of youth and protecting foster youth from bias and discrimination that commonly prevents them from accessing appropriate reproductive and sexual health information, services, and care. So STRTPs should share and discuss youth rights, as Alyssa mentioned, when they first enter the program and at a regular frequency. If the youth rights are violated, they have the right to file a complaint without fear or retaliation. STRTP staff should be familiar with those rights, as Alyssa mentioned, and the Reproductive Sexual Health Know Your Rights brochure, the rights of LGBTQ youth, and around sexual orientation, gender identity, and expression are all up here and in the guide. The guide provides the links for accessing these resources. I saw one of the questions was about, oh, do we have these brochures and links? And yes, we have them, and they're in the guide itself. So the next one is just to clarify from interim licensing standards that STRTP staff should know that those standards prohibit them from imposing their personal feelings or religious beliefs about reproductive sexual health on youth and influencing the treatment choice of youth. So these have been the common complaints that have led to grievances and even lawsuits filed against group homes. And as Julie and Gina discussed earlier, and Clayton, the best way to protect youth from this form of bias is to include that screening and hiring practices. And Appendix A of the guide provides a checklist for reviewing and update an STRTP's policies and practice for hiring and supervision of staff. To comply with the law, STRTPs must ensure youth are able to share a bedroom or use a bathroom consistent with their gender identity, regardless of the gender or sex listed on legal documents. The Appendix B includes a number of resources to assist with how to raise LGBTQ and gender nonconforming children. So please utilize those resources. Licensing standards also prohibit discrimination or harassment on the basis of the youth's identity or status. So should youth experience discrimination or harassment, there should be that assistance in filing a complaint, and STRTPs should have clear policies prohibiting discrimination, strong supervision practices to ensure that youth are free from discrimination or bullying in the home by staff or other youth. As we mentioned, the publication includes a printable checklist for updating the policies and procedures of STRTPs to ensure they are fully in compliance with current laws and regulations. Appendix B of the resource, the publication, contains active links to all of the resources that we've mentioned today and will help STRTP staff implement the policies and best practices with that support. If you'd like to join us on September 30th to learn more about the 2 new training tools designed for STRTPs, please register using the link here. The webinar will be from 10 to 11:30 a.m. and the links here take you directly to the online training and the training guide for in-house training. So if you are an STRTP and would like to join our learning community and receive assistance with updating your policies, practices, and finding appropriate resources that are age and developmentally appropriate, feel free to send me an email. You can do that right now. The learning community meets monthly and is a great way to learn with your peers and from other STRTPs like those who presented today. So there's others that are on there. We're working on great practices and nursing protocols, all different good things to check out. So that kind of wraps up our introduction of this new publication, this new resource, The Key to Compliance around policies and practices for STRTPs. And we do see a number of questions in the control panel here. And Simone has been answering some of those. So go ahead and write in your questions and we'll kind of start to answer those now. We've got about 10 minutes for Q&A. So don't be shy. Let's see, Simone, where would you like to start with the Q&A? I know you've been going through and answering a number of questions.
Yeah, so I'll dive in here. So first, I just want to say there was a number of people that thanked Christina for her sharing her story and said that it was helpful information. As far as questions, some people are talking about how COVID has impacted all of this, which is obviously an elephant in the room. Things have changed. And they said they used to have someone come out from the health department to talk with their to their teen clubs twice a year. Other people said the educators were let go that they had providing sexual health education to youth. And so people want to know, what are the resources now available to provide this type of education to youth? So Anna, I don't know if you want to share a little bit about Planned Parenthood, Pasadena, San Gabriel Valley, or Alyssa, if you want to talk a little bit about that, but there are resources that are available still.
Yeah, I don't mind chiming in. This is Alyssa Miller from Hillsides. So like I mentioned, for maybe 8 years now, we've been having Planned Parenthood come to campus and hold groups for our clients. But since March, we've been able to hold them on Zoom. And so our clients in the cottage, there's about 8 to 10 of them, will sit around the big television and we connect it to a computer, which is connected to Zoom. And the Planned Parenthood educators are on the other end and they have a PowerPoint presentation. They have some activities, some discussions, and the clients will just ask questions through the Zoom. And it's actually worked out really well. I think in some ways, not being face-to-face has allowed some clients to be more vulnerable and ask questions maybe they wouldn't have in person. So I actually think there's some pros and cons, of course, to virtual learning. But it's actually been working out well, and Planned Parenthood is now moving through all of our cottages. So we started with our 15 to 18-year-old girls, and now we're moving down and doing it for our 12 to 15 and then our 5 to 12-year-olds. So we've been able to make that work, and it's going well.
Great. And again, there's a Planned Parenthood roster, and you can find your local Planned Parenthood, see if they offer something like that. And then also, I know that the Planned Parenthood Pasadena San Gabriel Valley is very generously has offered to kind of assist, people outside of their immediate area with making sure they can access resources either through their local Planned Parenthood or through the Planned Parenthood in Pasadena San Gabriel Valley. So also you can kind of reach out to them if you need additional assistance. So the next question we have here is, I would say for let's see, maybe for Hathaway Sycamores, it says, I'm curious for the STRTP training staff. What topics need the most time in training? And do you find there are any common misconceptions your staff holds prior to the training?
What topics take the most time? I would say there have always been conversations around the laws. So the confidentiality laws, the any laws around the youth being able to do these things, access care, obtain protection, all of these things on their own is often met with not if that was my kid or things along those lines. So that, like Clayton said, that's our biggest challenge, is kind of making sure that staff are not communicating on to the youth whatever their implicit biases are or how they grew up. And then the other interesting thing that I found is the SOGI explanation. To be quite honest, sometimes I get confused. So I think that one takes a lot of time because there is a lot of information given.
If I could chime in, this is Gina from Hathaway Sycamores. I think what was really helpful for us is priming the staff before these training topics, because it's amazing. You know, I think the lack of knowledge people have, and that's not a judgment, it's just a fact that, you know, a lot of people, a lot of staff, our direct care staff, don't know these things coming into the job, and understandably so. So I think priming them and preparing them in terms of just having real conversations, say, you know, you're going to hear some things in this training that might challenge your perspective, will challenge your perspective. And we, you know, can you have an open mind? We expect that, and then be able to also get feedback if someone is struggling, being able to provide them with additional and individualized support. But I think preparing them for the trainings ahead of time with those conversations, whether they're in unit meetings or individual or group supervisions, has been very helpful.
Thank you. So we have a question, would there be a training such as this one for foster family agencies? So there are a number of training curricula that exist specifically that are SB 89 compliant. We will send that out. There is one that we actually worked on for resource families, and we'll send that full list of trainings out with the materials. There's also a question about, oops, lost it, where did it go? There we go. Does this transportation requirement apply to NMDs who are in THP NMD housing as well? So yes, it does. So it is for, you know, caregivers and placement providers. So anyone who is a foster care placement provider does need to facilitate this transportation, provide this transportation. I think, Anna, did you address, someone said, is there a basic handout for the sexual health rights of foster youth? I think you
Yes, so in the resource appendix are the links to all of the resources mentioned today. So you open up the guide, download the guide, go to Appendix B, and also the Healthy Sexual Development Workgroup and our JBay websites have those. If there's anything you're having a hard time finding, just go ahead and email us.
Thanks. Is the storage space for youth's personal belongings required to be kept private? Anna, do you want to take this one?
Yeah, so storage space, so it should be in their kind of private space in their room. It is for them, it is for their personal belongings. And in the part of the recommendation in the written guide, the publication that we've released today, it goes into those policies and has the code reference to that if you need to review the law there. But yeah, that is for youth to keep their own personal belongings and to have that privacy. That's very important, especially in kind of a more congregate setting.
Thanks. So we got this question twice. It's about confidentiality, which always can get a little bit challenging or complicated. It says, for our counties, we're required to send a document of medical visits to the county's public health nurse to update their health and education file. Is that then illegal to do for sexual health appointments that might disclose a pregnancy? So that one, really, so what our attorney partners with LA Rep would say to that one is that, any and all advice on how to fill out forms should be discussed with administration and legal counsel. But since you explicitly own the right to disclose pregnancy or not under HIPAA, agencies could possibly violate HIPAA if they disclose protected pregnancy information, without explicit use permission. And so what's helpful is to create some internal advice and practices. So for example, making sure that this reporting mechanism includes an option to report that a medical appointment happened without details about services provided. So if that doesn't already exist in your county, it's something to probably take up and make sure that there's an option there for that. And then also you can refer to ACIN I-0620 and ACL 1632 that might provide some additional information for that question. We are right at 11:30. Let's just take maybe one last question. Clayton, Dr. Johnson, are you still on the line? I know you had a scheduling conflict. I just wasn't sure if you stayed on for Q&A.
I think he had to jump off.
Okay, there's a question for him, so I'll skip that one. But let's also, there's a comment here. I'll just read this comment. And so this is Rebecca Gudeman with National Center for Youth Law, and they lead LA Rep. She said, feel free to refer people to Nicole or LA Rep for additional support and training related to confidentiality and legal rights. And maybe we can put her email in the chat box. I'm going to do that right now because I know that this comes up a lot and can be confusing. So I'm going to send that. And I think we're at 11:31 now, so we do have to close. But I will say, I know there are questions we didn't get to. If your question did not get answered and you would still like an answer, feel free to email us and we will respond to you with an answer. Thanks so much, Anna. Anything else you want to share before we close?
No, I was just frantically trying to answer these questions. There's a ton of questions in here, and I'm happy to answer them. So here is my email, and I just want to say thank you to the hundreds of people who joined us today and who are supporting youth and young people. Again, we're here to support you in this work, and thank you for all that you do for youth every day. So please have a safe and enjoyable holiday weekend, everyone, and we'll connect soon, and hopefully we'll see some of you joining us in the learning community moving forward. So looking forward to more work together.